A very good afternoon and welcome to our session on the topic Why Do I Need Pap Smear? We are glad to have Dr. Mythri Sharan with us who will talk about the topic briefly, highlighting the important points and explaining us the minor details of the topic. The doctor will help us understand more in detail. And also, if you have any doubts, any questions, put that on the comment section. Our doctor is here to help you. Doctor, you have this stage.
Hi, I'm Dr. Mythri Sharan. I'm a consultant at Apollo Cradle Jubilee Hills, Hyderabad. Today we are going to start the topic about why do we need to get the pap smear and what is the importance. So when I really posted this yesterday, half people asked what is a pap smear because half the people don't know what is pap smear. And even though that when the people come to the OPD also 70 to 80% don't know what is pap smear. If that 10% knows also, they get routinely as a blood test, but really they don't know what exactly it is. So let us discuss all the things about the pap smear. So, so what is pap smear? It is a test to detect the cervical cancer and pre-cancer cells before it develops in the early stages, which can be easily treatable. The main concept is pap smear is for the detecting the cervical cancer. So why usually we don't come to the hospital and ask like do we have any cancer or do we have any problem. No one comes to the hospital asking can we detect the cancer, but there is a test which we can detect prior only, that is called for the cervical cancer, that is main important is pap smear. Okay, so end of this session, I wish all understand this test and let your friends, colleagues, and whatever pass this information and be the part of this campaign of awareness. So coming to the, so I'm telling the pap smear is for the cervical cancer. So first of all, we should know what is cervix. Okay, it is a, you can see there is a mouth of the uterus. It is a mouth. It is above that, above the vagina, which we, or we can say is the opening of the uterus. You can see here. This is the cervix, and this cannot be seen from the outside. Even we have to see through the vagina speculum examination, and we can see the cervix. And there we have to take the test. This is called the pap smear. So, if someone asks me why, who are at the risk of the cervical cancer, I can say every woman who have the cervix are at the risk of the cervical cancer, and it is one of the few cancers where the definitive cause is because of the human papilloma virus. So usually, any cancers, most of the cancers are genetically related cancers, but cervical cancer is not like that. It is not genetically transmitted. It's most of the thing. It's caused by the human papilloma virus. And why I'm specifically keeping concentration of the cervical cancer, because cervical cancer is the second most cancer in India after the followed by the breast cancer. And in every year we detect more than 1 lakh cases of the cervical cancer, and 75,000 deaths are detected because of the cervical. And it's a most alarming situation that the 75,000 cases detect with the deaths is really a big alarm situation to actually to reduce the cervical cancer. So this is the one test which we all can get it done and help for the reduction of this death rate. Definitely. Do you think why you have this death rate more? Definitely because of the lack of awareness to the people. Because though we have this test, but our death rates are increasing, means there is a sign that we are not aware of this test. So at the end of the session, hope everyone will get information regarding this and get this test done. Second, so coming to the virus which caused this is human papilloma virus. This as everyone are familiar with COVID virus, there is something called human papilloma virus. It can affect both male and female. It does not only affect the female, it also affects the male, but in different ways. Okay, there are more than 200 types of human papilloma virus types, and among that, low risk and high risk. Low risk usually causes genital warts, and high risk like 16, 18 are very important, and they are highly isolated in the seen in the cervical cancer. So in lifetime, once you're sexually active, you might be exposed to the HPV virus. But all the 200 types of the HPV virus are not harmful. Only these types are really very harmful. And how it spreads, usually mostly with the sexual contact. It might be vaginal, anal, oral, or skin to skin contact. So these sexually these transmitted, and somehow we can prevent by using the condoms. So that's the reason we promote best barrier method to prevent sexually transmitted diseases or HPVs um, through the condoms. So how actually it does this virus enters into the body? As I told, 200 serotypes are there, and among that, the 200 serotypes, once they enter into our body, uh, because of our immune system, 80% of the people, the HPV virus is completely removed from the body. Only in 20% of the people, it may turn into the cancer based on other risk factors. So actually, the pathology is like an infection goes by its own. It body capable to remove. As I said, usually they may have no symptoms. So in our lifetime, one might get exposed anytime with the HPV virus with the different types of serotypes, and because of our own capable immunity, which we can remove the virus half the time so that we may not have symptoms. But in some, we don't know who are those some people, and it may persist and develop into the precancerous situation. And if you're not taking hold on the precancerous place, it and if you're not treating well, that it may develop into the cancer. So, what are the risk factors usually promoting all these things? Definitely, cigarette smoking is one of the risk factors which reduces your immunity and also promotes more of the HPV infection to change into the precancerous. And so, early sexual intercourse is also one of the risk factor. And as I told, like multiple sexual partners, reduced immune treatment, and untreated sexually transmitted diseases, improper sexual hygiene, and all these are the risk factors for the HPV virus to enter into the body. So usually what we say is once it enters into the body, the HPV virus to convert to cancer, it takes 5 to 10 years to change to cancer. So that's the reason the Pap smear role comes here. So before it is changed to precancerous to cancer, we can, if we can detect the precancerous stage, we are not in the or early stage of the cancer. Really, we can have lot of modalities of the treatment rather than going for the end stage of the treatment. So that's the main reason. That's a more enlightened parties. Pap smear has a very big role, like to detect the precancerous or any inflammatory cells, because this HPV virus takes 5 to 10 years, and we have a lot of interval to detect any time. So, as I told, HPV infection enters into the body either with the early sexual activity or multiple sexual, multi-party, or sexually untreated transmitted. And 80% it causes spontaneous clearance within 6 to 12 months, and in 20% it causes persistent infection. And because of other reasons, like on the persistent infection, on top of that, and if you have any smoking, immunosuppression, all these HIV or whatever reasons, the immunity of the body comes down, and this results in the precancerous situation. And if we leave it, it changes into the cancerous situation. So that's the reason, if we can detect at this stage, we will not be in the end this stage. So what are the tests? So coming to the original topic, what are the tests we can do for the cervical cancer screening? So the cervical cancer screening, there are tests like Pap smear test, human papilloma virus directly detecting test, and co-testing, which we use Pap test and HPV test. So these are all the screening tests which are available. So Pap test, by doing the Pap test, we can detect any abnormal or precancerous cells in the cervix. So you can see what are the when we have any inflammation or any precancerous. This is the test we can detect under the microscope. Coming to the HPV test, in the HPV test, this is a little advanced than the Pap smear test. Here we take the HPV virus directly, and we can see directly. We can isolate the virus directly, and we can see. So usually by doing the screening test, cervical cancer rates has been dramatically worldwide. We can reduce and save the millions of the worldwide. So that's the reason we have to promote the awareness about the Pap smear. So now the coming thing is how we do this test. So, as I told, this test cannot be done superficially. We have to do internal examination by using the speculum, and we visualize the cervix here. And here we use either this brush or wooden spatula, and we scrape the cervix and collect the cells. And these cells are sent to the lab, and we see under the lab and find out any precancerous or cancerous cells there. Coming to the first question, who should get the screening? That is the main topic. So, who all should get the screening? Every woman more than 21 years who are sexually active has to get this test, irrespective whether you are not married or married or not married. If you are sexually active and you are more than 21 years, please you have to get this test. Okay, less than 21 years is not needed. So how frequently you have to get? As I told, there is a 10 years interval for us. So how frequently we have to get this test is very important. That is from 21 to 30 years, 29 years, you can get, you just keep in the mind, you have to get every 3 years if it is a normal pap smear. But if you are doing co-testing, or if you are literally little advanced to the HPV testing, you have to get it done once in 5 years. And this test has to be done starting from the 21 years up to the 65 year, almost up to 65 years. And 65 years no need after a adequate negative screening reports if you have. Okay, so the first question comes, most of the people say, I got so for how frequently for other people is like, for HIV positive people or high risk people, we advise for the frequent screening, that is annually we go for the screening. And another question is, women who underwent hysterectomy also come for the normal health checkups and ask for that. So definitely, when we know the reason for the hysterectomy, it is not related to the cervical reasons. They don't need any screening. But if it is sometimes there is something called subtotal hysterectomy, where we leave the cervix and remove the uterus. In that condition, the screening will be the normal, like other people. So one thing you have to keep in the mind, more than 21 years who are sexually active, everyone should get the pap smear done. And if it is less than 21, it's okay. But everyone more than 21 years, you have to get this testing every 3 years. Coming to the these are the questions which I usually see in the clinics or OPDs, where the patient asks me this question. So whether the test is painful, if you ask the test is painful, I can say not really, but same time it depends upon the patient to patient, the discomfort and embarrassing things and whatever reasons. But it's not exactly painful. It all depends upon the discomfort the patient feels. Second, how much time it does take? It takes only few minutes. It doesn't take hours. It's just you can just walk in, and you can just normally you can get the test, which we can finish within few minutes. So what is the right time to do the pap test? This is a very important question. You can get any time the pap test, but only thing is you should not bleed. When you are not bleeding only, it's better. And also when you are using if you are having any vaginal douching, or if you are using any vaginal tablets, it's always better to come for the pap test after the 2 days post usage. Okay, what is the cost of the pap test? Pap test varies from hospital to hospital, different to different. We in the pap test also we have conventional pap smear test, and also we have something like liquid based cytology. So if the conventional pap smear, it just take on the slide and send it. But the advantage of liquid based cytology is we can the cells all which we take from the brush, we collect in the fluid. So they have a lot of advantage with the liquid based cytology compared to the pap smear. But what I say is, whatever is available, it's better to take anything rather than not taking any test. Okay, so when it comes to the cost, it may comes from 1000, 1500 to 3000. If it is a liquid based cytology, it was almost 2500. But this test has to be done every 3 years, not like routine 1 year. So the question is, what if my test is abnormal? So one thing is, pap smear is not confirmatory test. So once it's only a screening test. Screening test is a test which we do for the population when we fit into the criteria. So it is done for the almost everyone. So usually when we detect any abnormal cells or cancer cells or anything, we follow up with the proper specific test or further testing to confirm the test, but this is not the confirmatory test for the cancer. So once we see the cancer cells, we recommend for the other test to confirm whether it is a cancer or not. So this is only a screening test whether it is abnormal or normal, we have any cancer cells, but not nothing more than that. Okay, abnormal pap smear can be followed by frequently or confirmed by further testing. So the most important thing is cancer usually does not give a second chance. Prevention of cancer is always better than the treatment. So everyone I say, so because this is my own experience. When I see recently, I have seen a patient at 42 years without any other complaint. She just have urinary problems and just bleeding PV. So she was neglecting and she went to urologist and all, but speculum examination was never done to her. And when she came to us, when she frequently said urinary complaints and there was on and off foul smelling discharge, then I did the speculum. There was a growth, and we have sent the biopsy, and it has come as cervical cancer. So the thing is here, the main important point is when I went back and asked her retrospectively, did you get know about anything about pap smear? She has said no, and she was feeling so regret that if she really knows that test, she might get that test definitely. Who wants the cancer to get into the body, right? So that's a takeoff point, is like, everyone please get the pap smear test. It is nothing like only if you have symptoms only you have to come to the hospital. And don't get scared like because it's for cancer, why should I get this, all questions please keep aside. And please come to the hospital. It might be any other hospital. It's not like you, whatever feasible to you, please get the pap smear test getting done. And please pass this information to all your friends, colleagues, so that it will help to others also. And as I said, we are in the second place, so that because of our awareness and all these things, because of more of pap smears, we can really reduce the cancer. So prevention is better than cure. That is very important. So when we have some test which can detect prior only and we can help ourselves, it's always better to get the test done instead of neglecting it. Okay, next year I'll do, next month I'll do. Okay, it will be painful. So once you come to the doctor, we explain it and just get the test done. Okay, so behind every successful woman is herself. Why I kept this slide is definitely we do so many things for the whole family, but we never take care of ourselves. So for everything, ourself is very important. Self care. So this is the part of one thing which you can take care of, self care, and get this test done and help in the further any other thing. It will not only detect the cancer cells, it also detect other infections or any other gynec checkups also you can get through this perspective examination. Thank you. So I can see some of the questions here. Dr. Manadeep saying, what if CA 125 is 188? So this is not related to this, but CA 125 have other factors also which can cause raising the CA 125. Before that, we have to evaluate it. So CA 125 is not related to cancer cervix, but still CA 125 other causes are there, like endometriosis, ovarian cancer, and all. We have to see the scan and we have to see the symptoms, and then only we can interpret the value. Any other questions? Okay, thank you everyone.